you're now one of the biggest voices pushing against, but you've come from the other side of the table. So talk about your involvement pushing for and the pivot you made to what you're doing now.
Yeah, so my story is I born and raised, I'd say, in the swamp. I was actually born in DC and raised there in the district, and really had dreams of working in politics. And what I learned after graduating college and working on some campaigns is that after the campaigns are over, people from both sides of the aisle inevitably are working for food and pharma companies. So you go in consulting after doing the campaigns, and that's what everyone is like now working together to help these big industries who pay the most money. So it was interesting. I didn't put all the pieces together, but helped Coke, make sure that food stamps are funding Coke, helped pharma make sure opioids continued to be prescribed. And had some problems with that. Didn't connect all the dots, but left that industry. Went to Harvard Business School and to become an entrepreneur, started some companies. So been an entrepreneur for the last 10 years. And where the pieces started connecting is my sister, Dr. Calley Means, as I said, one of my best friends, pride of the family, Stanford Med School, surgical residency, abruptly quitting after realizing that she was doing her third sinusitis surgery of the day and had no idea why the patient below her knife had inflammation, and actually was almost by design not taught why patients are getting sick, just taught how to cut open the basically food-based inflammation right in front of her, not ask questions. As we talked about, she quit and went on, is a great advocate for metabolic health. And then in 2021, as my previous company was being sold, which was in e-commerce, it really came together for me. So in early 2021, my mom was taking a hike and had a pain in her stomach, went to get a scan, and then realized she had stage 4 pancreatic cancer, died 12 days later. And at Stanford Hospital, as she was dying, the oncologists, the top oncologists in the world, were saying it was unlucky. But learning from Casey, it wasn't unlucky. My mom was on 6 medications. She was the normal American 70-year-old. She had high blood sugar, was on the metformin, was on the statin for high cholesterol. But, close to 50% of people her age are on the statin, right? This was normal. This was like, you're fine. She was told in her checkup 2 months before that she was healthy. She was on less medications than the average person her age. Her doctors were high-fiving her for being healthy. But her high blood sugar, her high cholesterol, her high blood pressure, her struggles with obesity, these were all warning signs of metabolic dysfunction that were never raised for her, that eventually presented itself in something life-threatening like cancer. That's happening to millions of people. Life expectancy now is going down for the most sustained period in American history since 1860. We are actually facing a crisis right now of life expectancy due to deadly diseases that for every person with those deadly chronic diseases, there's been decades of warning signs that are not called out by the medical system. So that helped me put the pieces together to my early experience working for these firms, inspired by my sister. So decided to devote my life to this issue. So working with my sister on a book, which will release next year, called Good Energy, available for pre-order this week, actually. These insights helped me start a company called TrueMed. And TrueMed, as I said, helps. TrueMed follows the science. We do medical intake. I'll say this one more time. At TrueMed, we follow the science and have a medical intake where people list the conditions that they are trying to reverse or trying to prevent. And for almost any condition folks list, obesity, depression, diabetes, etc., the best, most scientifically proven way to reverse or prevent that condition is usually a mix of a sleep, food, supplement, exercise intervention. And we simply just write that in a note. We simply just put that plan in a note that clearly the exercise shows, it's clearly the research shows that if you exercise 150 minutes a week, it's the best possible thing you can do to lower depression. And we just put that research in a note. And then with that note, people can buy exercise tax-free. they could use their HSA, FSA funds. So at Stanford Med School, my sister didn't learn how to write a letter of medical necessity for exercise, but it's perfectly appropriate. It's clearly delineated by the IRS that a doctor can recommend specific interventions. It doesn't have to be a pill. And that unlocks FSA, HSA spending. So we're making that super seamless, partnering with leading health and wellness brands to get people the medical notes that follow the science, and importantly, help them save money on healthy activities that aren't incentivized right now. So that's what the company does. And yeah, kind of connected with that, have been able to speak about my experience, which has been rewarding. And I'm just hoping to. My main goal with all of this, talking about these stories of seeing inside this corrupt system, is just everyone should have confidence to ask their own questions. Their systems, we all kind of know this high level, but these systems really are aligned against you. And it is okay to ask questions about preventing chronic conditions for you or your kids. You can question your pediatrician. It's okay.
Calley, as somebody who is so vocal in the public, sharing this message, and there is so much corruption and money, and big companies obviously don't want this info to get out and disrupt all the things they're doing. My question for you is, has there been any, and I'm assuming there must be, resistance and companies pushing back, threats as you're sharing this?
Yeah, I expected more. I've not received many direct threats. I think that is smart on their part because I'm not doing anything wrong. And if they did, I would just use it to create more of a fuss. So I think it's actually how I would advise them to respond, which has been surprising. But this gives my life meaning. I think these are powerful industries. I think they are committing violence to the American people, to be quite frank. But it gives me meaning to speak out. I mean, it sounds trite, but I mentioned my mom kind of dying, I think, at the hands of a broken system. I have a new, young son who I think is walking into a wood chipper. Kids in this world, particularly this country. So it gives me a lot of meaning to speak out on this, and haven't been too worried about it. But I think this is what we need to do. I see myself as one of thousands of people trying to chip away, and I think there's great value, to what you're doing. Communicating to listeners and having people on that have had massive impacts on my life. Preaching the gospel of root cause health and metabolic health, and I think if we keep chipping away, we're going to be okay.
I hope so. I think so. You've mentioned your son a couple times, and you mentioned before how at his daycare you need to provide all your own food because of the terrible options that they have there. What are some of the other things as a relatively new dad you've had to do to navigate this world that you've described?
I just think it's doing your own research and having awe for the journey kids are on. I mean, kids are born perfect. I think they have a predisposition to natural food. They have a predisposition to awe and wonder for the world. They like to sleep. They like to move. They're curious. And I think we systematically, with our institutions, from profit motives, beat that out of them. I mean, I mentioned John D. Rockefeller a lot, but I think he was one of the most dangerous people of the 20th century in world history. He also funded and helped create the structure for a lot of early childhood education. And his quote is that I want a nation of workers, not a nation of thinkers. We push kids who are on the fastest learning curves of their entire lives, learning how to talk, learning how to make sense of the world, learning how to walk, with not a lot of top-down training, but just curiosity and wonder for the world and exploration. We basically take that data of literally the fastest learning curve of their life and then sit them at a desk and lecture them. We feed processed food, shove it down their throats, and sugar water. We subject them inevitably to a lot of our psychoses as adults and chronic stress. So my thought is just how can we prevent as much as possible, transporting the psychoses of our society onto that kid and actually learn from them actually to how do we foster their and perpetuate their sense of awe for the world? How do we, on food, not give them poison? I mean, the parents have complete control over a kid's diet, for at least the first 2 years. It's just a simple principle, and it's not judgmental to anybody, but like it's like I think we just shouldn't give kids poison. We should not give them sugar, particularly added sugar. Should not, I believe, give them highly processed grains or seed oils. I think that should be the standard for kids, that we shouldn't be eating frankenfoods that, and ingredients that were created in just the last 100 years that were not biologically made to eat. So it's just from first principles. I am blown away. I mean, I'm just blown away by how we need to keep what kids are born with instead of push our own crap on them. It's kind of where I come from with it.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
The medical system has been an absolute abomination at chronic conditions, which lead to over 80% of U.S. deaths and lead to over 80% of U.S. healthcare costs. That is the conditions like obesity, like